Good afternoon, ladies and gentlemen. It's my great honor to be here today to serve as the keynote speaker for this conference. I would take 15 minutes to introduce how global health, digital health can be used to improve the health care. This is a so broad area. I cannot say I can summarize this in 15 minutes, but I will just bring this question to you and we can discuss further. So what is digital health? Digital health is the application of digital technology to improve the health of human beings. It has two key components. The first is involving the use of digital technology. And the second is the health innovation. So since today's topic is health innovation, we want to focus on more about this. With the increasing use of digital platforms, including social media and other community platforms, more and more digital health strategies were used to improve health. Especially, there was more studies conducted on the digital health research. And in this circumstance, what has been used to improve HIV care? I summarized the 6 key points in here. The first is prevention messages. Second is developing HIV and STI testing services, increasing PrEP uptake and adherence, refining big data algorithms for surveillance, optimizing clinical interventions, and assisting mental health services. Preventing message would be the most popular field for digital health. You can see digital health information messages everywhere. It was used to promoting digital peer-led prevention messaging through social media influencers or peer networks, and improving education on HIV care and other STI services among school children and adolescents. Also, digital processing strategies were used to develop tailored intervention messages for the communities, especially for key populations. In this circumstance, actually behavioral series will integrate this development process to make the prevention message more tailored to the community. So of course, digital health also used to improve HIV and AIDS care, including the testing services. It was used to increase access to HIV testing and improve all aspects of the 5M model for HIV care services. Especially, many digital HIV testing platforms were developed to promote and the awareness of and uptake of HIV testing. For example, in China, we developed a social media-based secondary distribution model to promote HIV self-testing among gay men. Globally, geolocation services also was developed to push information to promote HIV and other STI services. It was also used to facilitate knowledge exchange and communication with key populations and observed due to stigma. PrEP is becoming more and more popular. It's becoming one of the most important prevention strategies of HIV. Digital health was used to understand the discourse and the community perspective regarding PrEP. Also, cross-source strategies were used to identify the PrEP providers, so it can increase the access to PrEP care. In addition, digital health interventions were used to increase PrEP uptake and adherence, especially for adherence. For example, in China, we have a phase 4 trial, which we developed a cross-source intervention to improve PrEP adherence among gay men. This is the area of big data. When we use any social media platforms like Facebook or WhatsApp or whatever, the system will automatically capture some of our data. And this kind of data from the big data. This kind of big data can be used in monitoring and forecasting the HIV incidence and the deaths related to AIDS. It can also use to predict which kind of intervention are more effective in certain populations. So in this case, we can predict, which effects are more useful. Also, artificial intelligence was used to facilitate the selection of peer change agents to optimize its care. Regarding clinical interventions, I would like to say digital diagnosis, digital health for diagnosis are more popular. It was used to improve clinical care, treatment adherence, and the retention in care. There are so many examples on this. I would like to not to list all of this in here, but mHealth will definitely one of the popular topic. mHealth was used to improve healthcare, especially for treatment adherence. Gamification strategies were also widely used, especially in developed countries. It has made the interventions more attractive and fun to the participants. So it can use to improve the service uptake. Mental health is one big area for care. So actually, digital health intervention was also popularly used to improve the mental health services. It was used to address the endemic of child care to increase treatment outcomes. Especially, mainly the cognitive behavioral stress management system were developed. Since the many social media platforms can be used to build the online communities, it can be provided venues for peer support, and many intervention programs can be delivered through this kind of social media platforms or social media communities. People can seek emotional support or mental health care through this kind of platforms. Telehealth also becoming more and more popular. Telehealth counseling and the mental health support service in HIV care are becoming an important part of the traditional addition to the traditional mental health services. This table is very comprehensive, but I do not want to mention all the things in here, but I want to emphasize that there are many digital tools were used to improve care. There are also many challenges and gaps. And we are need to take many things into consideration regarding how to make the digital health intervention sustainable and scale up. But regarding scale up, we need to addressing many different issues. We need addressing the digital divide, addressing the gaps in big data, take the ethical and other barriers into consideration. We also need to engage in the community into consideration. For the addressing the digital divide, as we know, the digital divide digital platforms are usually expensive, and the network coverages are typically low in low and middle income countries. In order to scale up this kind of digital health intervention for HIV, we need to reduce the cost and increase access to this kind of platforms. Especially, we need to develop the digital ecosystems. So in this way, we can increase access to all these digital devices, to digital platforms, and to tackle the problems of digital divide. Well, thank you very much. This kind of protest is really the funny part and the most interesting part of the IS meeting. It's very, we are very supporting this. I'm going to repeat what I said for these slides. When we use the big data, there are many things we need to take into consideration. First, we need to think about who are usually missed out in our big data. Whether this missed out are different from those who are captured, and whether we need to have additional strategies to capture this the data who are missed out. When we use identify the data of big data, when we predict who are in actual risk, we usually want to push the interventions to them. Whether we can re-identify these people who are in care. For example, when we predict people already got infected with HIV but not into care, how we can re-identify these people in the big data. We also need to think about whether big data will bring additional stigmas and whether people may have elective attitudes regarding big data strategies. Will this elective data attitude impact the intervention? We also, when we use the big data, we need to always think about the safeguard. how to protect the state safety, how to protect the privacy of the participants. We need to develop country-specific algorithms to protect this kind of state safety, to increase the state safety and protect the privacy. When we use the big data, we always want to include the community, not only for trials, but also for qualitative studies. For trials, we need to develop the people-centered intervention strategies, and we need to take the community perspective into consideration. When we use the qualitative studies, we need to amplify and diversify the participants' voice. There are a few things we can do to increase the community engagement, including define the problems with the communities, co-construct the data duration process with the communities, use participatory strategies, and integrating grounded in lived experience. Of course, we need to co-create data visualization and dissemination plans with the community. There are many things we need to take into consideration when we want to scale up digital health. I think we are on the way, and we would like to develop all these things together with all of you. Thank you very much.